May is Lupus Awareness Month, and Lupus SA is calling on supporters to join efforts to bring attention to lupus, an autoimmune disease whose symptoms are not always readily apparent. Now, lupus is a chronic autoimmune disease where the body's immune system mistakenly attacks its own tissues and organs. This leads to inflammation and pain in various parts of the body, including joints, skin, kidneys, heart, and lungs. Symptoms can vary widely and may include fatigue, rashes, joint pain, fever, as well as hair loss. Now, while there's no cure, treatments can help manage symptoms and improve the quality of life. To help us understand this better, we are joined by founder of Andrea's Gift, Una van Rhyn, and this, of course, is a non-profit patient advocacy organization that aims to educate, raise awareness, and offer support to people with lupus, as well as Lolo Lekgoane, who is living with lupus. It's great to have both of you, and thank you very, very much for being with us.
Good morning, Leanne.
Thank you. Thanks to both of you. Una, let me begin with you. So we look at lupus, we say that it's not curable, but it is very treatable. Let's talk to treatment options. What are available at the moment?
Yes, good morning. Just want to thank you for the opportunity to present Lupus South Africa and Andrea's Gift Foundation on this platform. And good morning to the lupus patient that is going to tell a story. Let's start, Leanne, with what is available in South Africa currently, whether you're in private care or whether you are in or you enjoy medical aid. So the standard treatment is chloroquine, and I think most people will remember chloroquine from the COVID days. And anti-inflammatories is another option, and steroids. Steroids is, of course, for the inflammation and the pain. If you do have organ involvement, you will receive immune suppressants. So that's the standard treatment out there.
So I think let's go to you, Lolo. So we know about the treatment. We will ask you how effective the treatment is, because you are a person living with it. But let's go back to the beginning of your story. When did you find out that you had lupus? Well, and what has this journey been like for you?
So I got diagnosed in 2012. And honestly, my symptoms were just joint pains and like extreme fatigue. Like I'd get so tired to a point, Leanne, where I couldn't get out of bed. And then during winter times, I would get extremely cold to a point where I put on like layers and layers of clothing, but I'd still get cold. And then I had what also we refer to as the butterfly rash. So I had a rash on my cheeks. And I remember that day very vividly. I couldn't breathe and I couldn't, get out of the couch. And I called a friend of mine to rush me to hospital because at that point, I honestly felt like my soul was about to leave my body. And we rushed to hospital. When I got there, by God's grace, the physician that happened to be on duty that evening just saw me. And because of the symptoms that I had presented, she immediately said to me, you've got lupus. And the other thing is lupus is extremely difficult to diagnose. So I don't even know why she actually, concluded that it was lupus. And yeah, post the diagnosis, it has been quite a challenging time in terms of me losing my vision. Every single year for the past 6 years, I know that for about 3 to 4 months, I'm wheelchair bound. So I literally have to go back to learning how to walk, learning how to feed myself. If I'm not on diapers, then it's the vision loss, it's the hair loss. So that's been my journey for the past 13 years.
Wow, Lolo, that is incredibly tough. But now that you're on treatment, does it give you a better standard of life, a better way of life? Is it effective in managing the pain, the fatigue, and all of these other factors that you've spoken to us about?
I think it is effective, Leanne. Apart from the fact that it's extremely expensive, but it's quite effective. I mean, it does kind of minimize the symptoms. It doesn't take them completely away, but you are, you have an opportunity to live a somewhat normal life because of this treatment. So I would say that it has been quite effective. Also the fact that I'm also on chemotherapy, so I go for chemotherapy twice a year. So I think a combination of the daily tablets that I take as well as the chemo has somewhat made it a little, bearable.
Yeah, let's come back to you now, because I mean this is a very difficult thing to manage, lupus, and just listening to Lolo and what she goes through on a daily basis, and you look so beautiful with it, and that's what's getting me. I mean, you are managing this so beautifully, but not everybody does. You talk about the expense of it, you talk about possible side effects. So, talk to us about this and trying to assist people with managing lupus.
Okay, lupus is very difficult to manage. It's difficult to diagnose and difficult to manage, and each person present lupus differently. In other words, if two people have lupus, they are on different treatment and there's different side effects, and there could be different overlapping diseases. So that makes it even more difficult to treat. However, sorry, I couldn't hear Lolo's answer, so I would like to interact with that, but I couldn't hear the sound. But there is a way to manage it, but it is a very individual treatment plan for lupus. There's not just one treatment plan for lupus. Like, for instance, if you have diabetes or cholesterol, for lupus, it depends on the individual who has lupus. Just want to go back to the treatment options. There are biologics available in South Africa. It's not available in the state, but it is available if you have medical aid, which has less side effects, but it is very expensive. So even if you have medical aid, they normally are a large co-payment, but that is the better option. So those are more options available.
Yeah, Lolo, in terms of your diagnosis of lupus, do you understand it well? Was it genetic, hereditary, or is it something that you just developed? I mean, talk to us about the history of this, and if you have this in your family as well.
Do you know what the funny thing is, Leanne, is my aunt was sick for a good 13 years, but she was misdiagnosed. So all along, we thought it was arthritis. So she was being treated for arthritis, but little did we know that it was actually lupus. It had to take a doctor from another country that came and, did the proper tests. That's where we actually got to find out that it was actually SLE, it was lupus, and not arthritis all along. But unfortunately for her, it had already been so severe that her organs were failing. Her fingers had to be amputated. Her skin was rotting. So the diagnosis came at a very late stage. And so I'm not too sure if it's genetic, but in my case, because my aunt had it and she passed on at the age of 33, so I'd like to believe that it probably is, although, it hasn't been proven as yet, but chances are it might be genetic.
Sure. I'm sorry on the passing of your aunt. I mean, that sounded incredibly tragic. In fact, I have a very similar story of an aunt who passed on from lupus too, and it's a terrible thing to watch and literally eat somebody alive. But Una, talk to us about it. I mean, what do you believe causes lupus? What is it that is there? And perhaps maybe also talk to us about early symptoms.
Yes, Leanne, lupus is, as I said, complex to treat and complex to diagnose. Like Lolo said, it can definitely be in the family. They often see it's in the family. In my family, I have one daughter passed away from lupus and another daughter has been diagnosed a year ago. So often you do find it in family. But there's 6 or 7 criteria why you get lupus. So it's not like any other disease that you take a blood test and it says, like cancer, okay, you have cancer. So it's very complex. So there's an ANA scale that you do a blood test, and it can be positive or negative, but that has to come with 6 or 7 criteria and a whole history of medical illnesses. So you understand why often people wait 6 or 7 years before they get diagnosed, because it is not easy to diagnose. So lifestyle, hormones, genetic. So the list just goes on and on. That's why we call it the mystery disease, because it's so complex.
Yeah. It certainly does sound that. And I mean, lupus, can it be mistaken for other diseases? Because I know, in fact, Stacey was our sports anchor walking out. She threw a little pearl to me saying, ask about the confusion between lupus and fibromyalgia. Is that often confused? Una, let me come to you.
Yes, lupus often mimics other diseases.
Okay.
Fibromyalgia, rheumatoid arthritis, and now again I come back to why it often takes 5, 6, 7 years to diagnose it. So it's very difficult. We've just done polling, and 45% of our members with lupus also have fibromyalgia.
Sure. Yeah. So there is a very big link between that. But Lolo, do you lead a normal life? I mean, that's, I suppose, what we want to hear. You're on the medication. Is it as normal as it possibly can?
I don't, well, normal looks not normal with a person living with lupus.
Yeah.
I often say to, the people around me that you definitely have to mourn your previous life, because nothing about your life remains the same post-diagnosis. So I really do try and live a normal life. I mean, the realities of living with lupus, Leanne, is that not all days are the same. I mean, just this morning, I woke up with, I'm not sure if you can see, but I woke up with blisters on my arm.
Yeah, we can see that.
So this is, the realities of lupus. I was completely fine yesterday. This morning, as I stepped into the shower, I was presented with, with these blisters. So there's nothing normal about it, but I really just try to remain positive and just make the best of, my days, especially when I'm on remission.
Yeah.
I make sure that I live my life as, as beautifully as possible when I'm on remission, because you'll never know what tomorrow is going to happen. I could literally go to bed today, feeling completely okay, and then tomorrow I cannot get out of bed because I've got swollen feet, because my heart rate is not normal. It's really, you really just try and live a normal life as best as you possibly can. But although it's not really normal, but
I know normal is a terrible word to use, because as you say, normal is different for absolutely everyone. Are you able to work? I can't imagine having children is something that's possible either.
No. So I had to actually resign from my job in 2017, because one of the things as well with with our employers, they really don't understand. I really just try to raise awareness even in the workplace, because that's the most challenging place, where you look fine on the outer appearance, but what happens internally is completely different. And how do you explain to your boss, you come to work looking okay, but you have to telling him that you need to go to the hospital. So I was constantly in and out of hospital, to a point where he ultimately said to me, you know what, I cannot be paying you for you to be in hospital. So I had to resign, unfortunately. And when it comes to falling pregnant, my doctor said to me, can you just be in remission at least for the next coming 3 years? Because I honestly, I've seen you at death's door so many times that I don't want you to experience that. What's going to happen if, you have a child, a small child, it's only the two of you in the house, and, you can't carry the child. So, pregnancy, although it can be, normal, but it's at a high risk.
The aftercare.
It's definitely at a high risk.
Ladies, I wish I could continue, and I pray for you, particularly Lola, and Una as well, through what you've been through, with your daughter, and we just hope that there are new treatments and research that's being explored that can make this easier and better to deal with. I hope this starts a conversation amongst you, South Africa. We got to leave it there. Una van Rhyn, founder of Andrea's Gift, a non-profit patient advocacy organization to educate people about lupus, and Lolo Lekgoane, who is currently living with lupus. See you after this.